You've definitely seen them, those perfect circular marks on athletes, on celebrities. It's called cupping therapy. It's an ancient practice that's having a major moment right now. But what is it actually doing? And more importantly, what does modern science have to say about it? Well, let's break it all down.
Yep, there they are. Those unmistakable marks are pretty much the signature of cupping. We see them all over the place. But what's really happening to the body to create them? What's the science behind the suction? That's what we're here to figure out.
Okay, so first things first. Cupping therapy is a traditional treatment that's been around for literally thousands of years. At its core, the idea is really simple. A practitioner puts cups on your skin and creates a vacuum. That suction pulls the tissue upwards. But how exactly they do that can vary quite a bit. And that brings us to the two main types. First, you've got dry cupping. This is probably what most people think of. It's just the suction part. A cup goes on the skin, a vacuum is created, and it just sits there for a few minutes. The whole point is to boost blood flow, kind of like a deep tissue massage. Then there's wet cupping, which adds an extra step. After that first round of suction, the cup comes off, and tiny superficial scratches are made on the skin. Then the cup goes right back on to draw out a little bit of fluid.
Now, this is a really important point to understand. A lot of people hear wet cupping and think of old-school bloodletting, but that's not quite right. Practitioners will tell you the goal isn't to remove blood from your veins. The idea is to draw out the intercellular fluid, the liquid that hangs out around your cells, because they believe that fluid can build up with toxins, inflammatory stuff, and even heavy metals.
So what does a wet cupping session actually look like? Well, first, the area gets disinfected. A cup is applied with suction for about 3 to 5 minutes just to get the blood flowing to the surface. Second, the cup comes off and a sterile scalpel is used to make these really small, shallow scratches. Third, the cup goes right back on to draw out that fluid. And finally, once it stops flowing, the cup comes off, the area is cleaned up, and a dressing is put on. Okay, so we've covered the what and the how. But let's be honest, the biggest question on everyone's mind is, does it actually work? Is there any hard scientific evidence to back all this up? Let's take a look at what the research says. To get a feel for the research landscape, a big meta-analysis back in 2021 looked at studies spanning over 70 years. They found 381 scientific papers on the topic. And get this, about a third of those were randomized controlled trials. The gold standard of research, where people are randomly assigned to get either the real treatment or a placebo. This tells you that even though the practice is ancient, serious scientific interest is definitely growing. So what did all those top-tier trials actually find? Well, for pain conditions, the results look pretty promising. These studies found cupping therapy to be effective for a whole bunch of issues, like the pain from shingles, fibromyalgia, chronic back and neck pain, and even headaches. And the benefits don't seem to stop there. The research also shows some really positive results for our musculoskeletal system, so our bones and muscles. We're talking about conditions like osteoarthritis, rheumatoid arthritis, gout, and carpal tunnel syndrome. The studies suggest it can be a really helpful therapy for these kinds of issues. Beyond just pain and joint problems, the research is even starting to hint at a much broader potential. Some studies have found promising results for things like skin diseases, and even some neurological and cardiovascular conditions. Now, the evidence here is a little less conclusive, but it's definitely an area to watch. So, all of this naturally leads to the next huge question. If cupping is having all of these effects, how? What is actually happening under the skin that could cause all this? Well, scientists have a few really interesting theories. I mean, think about it. It seems so simple, right? Just some suction, maybe a few tiny scratches. How on earth could that reduce deep-seated pain, help with arthritis, and potentially affect all these other body systems? Let's dive into the leading scientific hypotheses. All right, theory number 1 is a classic. It's called the pain gate theory. The idea here is that the physical feeling of the cupping, the suction, the pressure, it activates these large, fast nerve fibers. These signals zoom to your spinal cord and essentially close the gate on the slower, smaller nerve fibers that carry pain signals. So the sensation from the cup basically gets priority, and the pain signal gets blocked before it can even reach your brain. Another really popular idea is the nitric oxide theory. This one suggests that the physical pressure from the cup actually causes the cells that line your blood vessels to release a molecule called nitric oxide. Now, nitric oxide is a super powerful vasodilator. In plain English, that means it makes your blood vessels wider. And when they're wider, you get more blood flow, which brings more oxygen and helps kickstart the healing process. And finally, there's the blood detoxification theory. Now, this one applies specifically to wet cupping. The hypothesis is that the fluid that's drawn out from the skin actually has a higher concentration of waste products, inflammatory stuff, and even heavy metals like mercury and lead compared to the blood just flowing in your veins. So from this perspective, cupping is literally pulling harmful things out of your body's tissues. Of course, with any kind of procedure, we have to talk about safety. It is absolutely essential. So while cupping is generally considered safe when it's done by a trained professional, it is definitely not for everyone.
The relative contraindications. This is more of a yellow light, a proceed with extreme caution list. It means cupping might be possible, but only under close medical supervision. This applies to pregnant women, people with severe chronic diseases, and anyone taking anticoagulant or blood-thinning medications. The good news is that for most healthy people, the side effects are usually pretty mild and temporary. The most common things you might feel are a little dizziness, fatigue, maybe some nausea, or just some lingering soreness where the cups were, but that usually fades away in a day or two. So, after looking at the practice itself, the research, the theories, and the risks, where does that leave us? Is cupping therapy just another wellness fad that'll fade away, or does it actually have a future in modern medicine? That big 2021 meta-analysis we talked about earlier really sums up the current scientific consensus perfectly. The authors concluded that, yes, the majority of studies show potential benefits, especially for pain, but more studies are needed. That's the key takeaway from the scientific community. So here's the bottom line. Cupping is this ancient therapy that's now getting some serious scientific attention. It shows genuine promise for certain problems, especially pain. But it's not a cure-all, and the science is still playing catch-up to fully explain exactly how and why it seems to work. We just need more of those high-quality studies to get definitive answers. And that really leaves us with a big question to think about. As the body of research continues to grow and as the studies get better and better, will this ancient practice, one that's been around for millennia, finally carve out a firm, evidence-based place for itself in modern medicine? I guess only time and a lot more research will tell.